So I completed my practicum with the North Bay Parry Sound District Health Unit, and the planned culminating project was to support reorienting the diabetes prevention project to the First Nations mental wellness continuum. I just want to start by acknowledging that I completed my practicum on the lands of the Algonquin, Saulteaux, Anishinaabe, Ojibwe, Ottawa, and Chippewa peoples of the Anishinaabe Nation. The health unit covers lands that were part of the 1850 Robinson-Huron Treaty and the Williams Treaties of 1923. The health unit covers a fairly low density but large geographic area in what people from the GTA might consider Northern Ontario. You can see from the map there's a whole lot of Ontario that is north of North Bay, and in my experience, residents are very quick to point that out to you. So you can see the mental wellness continuum model on screen now, and the decision to reorient the diabetes prevention project was influenced by health inequities and health unit obligations. Many challenges arose that made proceeding as planned inappropriate, but I still wanted to address Indigenous wellness while the health unit worked through some of these longer-term challenges. So my presentation is a commentary on some health obligations that inspired the project, challenges that arose while attempting the project, potential solutions to those challenges, examples that use those solutions, and implications. The info presented here comes from the UN Declaration on the Rights of Indigenous People, Indigenous teachings, and Indigenous health literature. So Indigenous nations have the right to self-determination, and for public health, this means Indigenous nations need to lead or influence any initiatives meant to serve them from the outset. Indigenous people also have the right to be free of discrimination or assimilation, while health units are obligated to be culturally safe. Further, cultural safety is needed to ensure the engagement required for self-determination occurs without harm. And lastly, Indigenous peoples have the right to revitalize the cultures that were oppressed throughout colonization. With this in mind, the mental wellness continuum with a cultural foundation developed the Assembly of First Nations and Indigenous mental health leaders appeared to be a good fit for reorienting the diabetes prevention project. Self-determination is often cited as the most important social determinant of Indigenous health, and the culminating project timelines did not allow Indigenous engagement from the outset, so right away the project failed to be self-determining. Another challenge comes as First Nation funding and therefore planning occurs at different times than health units. This makes the collaboration needed to support self-determination difficult. That being said, this separation may mean that the programming Indigenous nations choose to run is more likely to be self-determining. So supporting this programming provides an opportunity to support self-determination, but this may require some flexibility, and of course you're going to need knowledge of what that programming is. While there are some consistent aspects of cultural safety, Indigenous people are highly diverse, and what's considered safe will ultimately depend on the individual. So determining when a health unit is truly culturally safe and can safely engage cannot occur without engagement. Still, knowledge of the historical context that shape modern health inequities is believed to be a prerequisite of cultural safety. So individuals can become more culturally safe themselves by seeking out this information, while health units make slower progress towards cultural safety. As part of the planned culminating project, a lit review was completed that assessed the health benefits of cultural revitalization. And this review revealed a growing body of literature that supports the importance of self-determination and Indigenous culture. This evidence should be increasingly reflected in practice, leading to more examples of effectiveness. This could produce a positive feedback, which is a strength for health units who have a responsibility to pursue evidence-informed decisions. So in summary, self-determination is highly important and requires engagement from the outset. With Indigenous and health unit planning occurring at different times, it's likely that different priorities will be identified. However, self-determination is also more likely. Health units have an obligation to be culturally safe, and engagement is needed to define cultural safety, but cultural safety is needed to ensure engagement is harm-free. All this can create a lot of uncertainty. Reducing health inequities must be a priority, but doing so safely takes time and flexibility. So it's easy to wonder what the right way to proceed actually is. During my placement, I was fortunate to receive some Indigenous teachings that helped lessen some of the uncertainty stemming from those challenges. The first involves people from many First Nations who couldn't agree on ceremonial protocol, so it seemed a planned ceremony may not proceed. Eventually, an elder stood up and simply said, if it's done in a good way, then that is the right way. As organizations work through the diversity of Indigenous people towards cultural safety, this teaching shows us that given things are done in a good way, there's many right ways, not many wrong ways of pursuing cultural safety. Still, challenges remain in balancing the priorities of Indigenous people with those of a health unit, and for this challenge, it helps to look to another teaching. One day, a hunter found a dead eagle and, knowing its ceremonial significance, wanted to sell it to an indigenous man. However, purchasing the eagle would not be culturally appropriate. So the indigenous man went to an elder for guidance, and the elder simply told him to find the way to secure the eagle. So the man went to the hunter's cabin with some art and a whole lot of money, and the transaction ultimately proceeded as the man satisfied the hunter's monetary needs by significantly overpaying for some fish, and then offered his art in exchange for the eagle, staying true to his cultural practices. Here, the indigenous man's needs can symbolize indigenous protocols and priorities, while the hunter represents a more Western approach. The indigenous man showed us that some creativity may be needed to align seemingly conflicting priorities. Coming back to the Culminating project, it was determined that we could not proceed at this time. It failed to be truly self-determining, and the health unit had not reached the level of cultural safety needed to guarantee harm-free engagement. However, I still wanted to take action to promote Indigenous health, and this made identifying the right way to proceed difficult. Next, I'm going to provide some examples where I took on health unit requests that were not related to my Culminating project and didn't appear to relate to Indigenous health. Trying to learn from the Indigenous man who saw the eagle, I tried to be flexible and creative so that I could promote Indigenous wellness while addressing seemingly unrelated health unit priorities. My experience suggested that knowledge of Indigenous history, health literature, and priorities may help ensure that you proceed in the right way. My examples relate to composting and climate change and creating safe spaces. Starting with climate change, the health unit was looking to adopt more sustainable business practices, one of which would be composting. Initially, there was no real plan to promote composting on a wider scale, but it became apparent that the general population, and specifically Nipissing First, would benefit from the wider adoption of composting. Landfilling our organic waste releases a lot of greenhouse gas, but it also maintains our high need for fertilizers. Right now, much of Ontario's soil is vulnerable, and climate change is expected to accelerate rates of erosion. So with vulnerable soil and high fertilizer use, fertilizer runoff can be a big problem. It can enter aquatic systems and feed toxic blue-green algae blooms. Locally, Lake Nipissing has already begun to damage that these blooms can cause. Composting can combat these issues as it provides soils with nutrients, reducing fertilizer need, and also improves soil structure, reducing erosion and runoff. While reviewing Nipissing First Nations' annual report, I noticed that they're attempting to restore a sustainable fishery on Lake Nipissing. Algae blooms would actively counter their efforts, so promoting composting can support their self-determined priority. Further, a local fishery could improve food security, and some scholars believe that maternal food insecurity and its effects on prenatal brain development can help explain the intergenerational transmission of historical trauma. So with knowledge of local priorities and Indigenous health literature, what had started as a small project to address a health unit priority has since become a wider effort to promote composting and support a self-determined priority of a local First Nation. At the health unit, the Safe and Public Spaces Committee seeks to reduce inequities by creating safe spaces for the LGBTQ2S community. After attending an event on Two-Spirit Health, I was asked to bring the teachings back to the group. One of these teachings was that Two-Spirit lives at the intersection of being a member of the LGBTQ2S and Indigenous communities. So a safe space for Two-Spirit people must also be safe for Indigenous people. To understand the strength of the Two-Spirit resurgence, one should understand what Two-Spirit peoples have had and continue to overcome. This provided an opportunity to educate the committee on how colonialism has affected Indigenous culture and Two-Spirit lives. As I mentioned, understanding Indigenous history is an important aspect of cultural safety. So having knowledge of Indigenous health literature and integrating historical context into the presentation allowed me to address the health unit request of taking the event's teachings back to the committee while also shortening the road to cultural safety. Many health units still have a long road to travel before Indigenous health can be addressed the right way. Honest assessment may reveal that planned projects cannot, at this time, proceed in guaranteed safety or be considered self-determining. That being said, Indigenous wellness remains a priority. To safely address while long-term processes are underway, some creativity and flexibility may be required. By having knowledge of Indigenous health literature, history, and local priorities, one may be able to more safely align the priorities of health unit with those of Indigenous people. This may allow continued action on Indigenous health, while health units move towards being culturally safe and fully able to support true self-determination. And before ending, I just want to thank my supervisor, Jessica, and all my other coworkers. I also want to thank my instructor, Victoria, and all the other staff who helped to make this happen. And I really want to thank the many Indigenous people who generously offered up their teachings. Miigwech, thank you. And that's it. preferences.
Excellent. Thank you very much. That's great. You came right on time. Any questions for Patrick? A really interesting talk. Victoria.
Patrick, that was awesome. Thank you so much. One of the things, not necessarily a question, but more of a comment that, you know, I think to me, your presentation reflects how much we can learn when things don't go the way we expected. You know, when you have a particular objective for a major project and it just isn't, you know, able to be, you just aren't able to implement it the way you had anticipated or that kind of thing. So kudos to you for being adaptable and open to learning things that you might not have expected.
Thank you.
Kathy, you have a question.
I do. Hi, thanks, Patrick. I loved every second of that presentation. That was amazing. But I was just to poke a little bit, I guess. Dealing with uncertainty is not something we white folk do very well. And folks, you know who you are. All the folks who are like, what are the steps? What are the processes? Is there an acronym? Is there something I can use to work my way through this, right? We like certainty, we like steps. Can you talk a little bit about how you thought your way through this, how you came to the realization that the good way of doing things was not necessarily the planned way of doing things? Like, was there a moment when you kind of went, aha, or was it just, you just took a step back and let it flow? I'm really interested in how you came to that sort of self-realization, that self-reflection piece.
Yeah, thanks, Kathy. Definitely those teachings I received were at a cultural safety training event, and receiving those teachings, there was kind of a lot of aha moments there. I hate working with uncertainty, and it's something that obviously I think I need to work on, kind of working with uncertainty. But yeah, it was through those teachings, and it was kind of through necessity. Like, I had to find a way to continue to work, continue to make my time valuable to the health unit and to the people that it serves. So, I mean, it was really following the cultural safety training event that, after reflecting on the teachings and thinking back to the project and looking back through the obligations health units have to Indigenous nations, it kind of just all came together, fortunately. But it was also through necessity. Like, you just sit down and start writing, and the creativity starts to flow from there, and you start to find ways to piece things together, I suppose.